Welcome to the Health Policy Doc, where healthcare reform, the latest in health policy, and the politics of healthcare are examined. I'm Tom Clear, an author and health policy professional. Thank you for joining us today as we tackle the ever-changing healthcare landscape. In the United States, we are continuously either talking about healthcare reform or implementing healthcare reform. It has become a national pastime for politicians and policymakers. The Health Policy Doc will focus on healthcare reform and a variety of related topics. Throughout the conversation, one of the guiding principles or themes that will be embraced is that there is a positive financial return for society when everyone has access to healthcare. So the goal of the Health Policy Doc will be to identify the positive financial returns and explore which programs and approaches to healthcare reform will lead to what effectively is a societal return on investment. So, at a high level, what are the issues with the United States healthcare system? There are several issues to consider, and we're going to discuss 5 of them today. First, the U.S. spends far more than comparable countries spend on healthcare, but does not necessarily experience notably better outcomes. Second, too many people are uninsured. Third, the focus in the U.S. healthcare system is slanted toward the treatment of disease, not prevention. Fourth, there is too little focus on quality outcomes. Fifth, important but overlooked factors in the U.S. healthcare system are the social factors that impact health that must get more attention if we are ever going to be able to move the needle to a healthier population. First, let's look at healthcare costs in the United States. On average, other wealthy countries spend half as much per person on healthcare compared to the United States. The United States spends over $10,000 per person per year on healthcare. The next closest country is Switzerland, that spends a little under $8,000 per person per year. The next group of countries, Germany, Sweden, the Netherlands, and Austria, all spend between $5,200 and $5,500 per person per year on healthcare. After that group, Belgium, Canada, Australia, France, Japan, and the United Kingdom all spend between $4,200 and $4,800 per person per year on healthcare. So on average, the United States is spending twice as much as other wealthy countries spend. Next, let's look at health coverage, the programs or plans that provide access to medical care. In the United States, 16% of the population is covered by the federal Medicare program. 48% of the population is covered through employer-based plans. 23% of the population is covered through individual or other non-employer-based plans. 5% of the population is covered through the Veterans Administration and the military health system. And 8% of the population is uninsured, which is approximately 30 million people. Another shortcoming of the United States healthcare system is that the focus is on disease, not wellness. Now, there is a positive side to focusing on disease. The U.S. healthcare system is the best in the world at identifying effective treatments for disease. Identifying and implementing new treatments is a staple within the U.S. healthcare system. However, the lack of focus on prevention results in higher medical expenses and poorer health outcomes in the long run. Where does quality fit into the U.S. healthcare system? Well, medical professionals strive to provide the highest quality care possible. The Medicare and Medicaid programs build quality measures into the HMOs who serve their enrollees, and there are increasingly incentive payments designed to provide providers with additional funding when they meet quality measures. But overall, the current reimbursement system throughout the healthcare system incentivizes unnecessary tests, overutilization, and defensive medicine at the expense of focusing on health outcomes. One of the most critical factors missing for the U.S. healthcare system is the lack of focus on social determinants of health. Attention to services that address the social determinants of health, like food insecurity, housing, transportation, and physical wellness, currently have no place in the U.S. healthcare system. However, more and more people are recognizing the importance of focusing on social determinants of health. That's a positive advancement, and that must continue. Addressing these social conditions are critical to achieving positive health outcomes. For example, how can a diabetic patient control their blood sugar if they experience food insecurity and wonder from meal to meal what they will eat? How can a patient follow their treatment plan when they live in a park because they are homeless? How can a patient who suffers from depression improve their situation when they suffer from social isolation? These topics and many more will be the focus of the Health Policy Doc. Topics will be examined from the system perspective and the individual patient perspective. Programs that make a difference will be highlighted and championed. And ultimately, the investment in healthcare for society will be addressed from a financial perspective, showing the positive return on investment that investing in healthcare means for society. In this first edition of the Health Policy Doc, we will begin by examining some of the latest health policy proposals being advanced in the 2020 presidential campaign. We will start with President Trump. While the president has not formulated his healthcare proposals for 2020, we can look to his first term to glean where he will stand on fundamental issue of healthcare reform. We know that the administration does not support any kind of mandate for healthcare, considering they led the repeal of the individual mandate. The administration's policies will continue to move toward market-based approaches with less costly options. In the first term, this included association health plans, used by many small businesses to pool risk across states to purchase less costly health plans for their employees. Access to coverage was also expanded by allowing short-term, limited duration plans to be extended up to 12 months. On the Democrat side, nearly all candidates have outlined at least a piece of their approach to health care. Bernie Sanders is leading the way, pursuing a Medicare for All approach that includes the elimination of private health insurance. Kamala Harris is taking the same approach as Bernie Sanders, pursuing a Medicare for All program that will compete with private health insurance. Pete Buttigieg also favors the Medicare for All public option with the long-term goal of a single-payer system that allows private health insurance on a supplemental basis only. Kirsten Gillibrand is also pursuing the Medicare for All approach. Michael Bennet advocates for a public option plan, though maintaining the private market. Andrew Yang favors a Medicare for All approach, though he would not eliminate the private insurance market. John Hickenlooper supports universal health care, but does not believe Medicare for All approach is the way to achieve it. Marianne Williamson would like to see high-quality universal health coverage and supports the public option to go along with private health insurance. While the president and the Democrat candidates are speaking out about healthcare reform in the political arena, their proposals are rooted in policy, and the winner of the 2020 election will likely set the path for post-Affordable Care Act healthcare reform. Please join the Health Policy Doc next time as the discussion examines the public policy underlying the politics in the current healthcare reform debate. Thank you.